The call is free.
Welcome back. About every 2.5 minutes, someone here in the U.S. is diagnosed with lung cancer, and every day lung cancer takes the lives of more than 382 people. The disease remaining the leading cause of death in men and women. The survival rate has in fact increased, but it is still significantly lower among communities of color. Joining me this morning to talk about Lung Cancer Day is Dr. Barned and Brandi Bryant. Both are lung cancer patients. Ladies, I want to say good morning and just thank you for being with us.
Good morning.
Good morning.
Dr. Barnett, I want to start with you. Tell us a little bit about your story.
Well, I've always been active. I dance, swam, ran track, and I realized when I began my residency that my exercise tolerance was decreasing and I actually started wheezing. Thinking that I was getting adult onset asthma, I went to my pulmonologist and after a whirlwind of tests got a shocking diagnosis of stage 4 lung cancer, and I had no risk factors. I am a non-smoker and I got lung cancer anyway. So thankfully, they sent my tumor off for biomarker testing and I was found to have a mutation called ALK. And I've been on targeted therapies since then, and right now I'm no evidence of disease 5 years after the fact.
Oh, that's a blessing. So good to hear. And out of curiosity, how old were you when you were diagnosed with that, Dr. Barnett?
I was 33.
So young. And so that's important for people to know when you're having the symptoms, you know, never overlook them. Go to the doctor.
Yes.
And I want to ask Brandi, you were diagnosed back in 2018 and targeted therapy did help your cancer. Tell us about how that process worked out and how it helped you.
So my story is very similar to Dr. Barnett's. I was initially diagnosed with stage 3B at a local community hospital where they did send my tumor off for biomarker testing. Unbeknownst to me, like when you're first diagnosed, you don't think about these things. But thankfully, it was sent off for biomarker testing. And because of my initial diagnosis of 3B, I had to do chemo and radiation first. But because I did know my biomarker, when it came time for my second phase of treatment, I was able to get on targeted therapy, which has been fantastic for me. My youngest child was 3 when I was diagnosed, and I didn't know how long I would have. I couldn't even climb the stairs after chemo and radiation. There was a big fluid buildup on my heart. But just within a couple of weeks of taking that targeted therapy, I was able to climb the stairs again and, you know, spend time with my children. And it's been 4 years and I'm also no evidence of disease. And it's really made a big difference.
And what message do you ladies have about lung cancer research, especially for Black Americans?
Well, research is so important. That is where we get the therapies of tomorrow today. And that's one of the things that we want people to know. Clinical trials are safe and clinical trials are the next alternative if you realize that traditional therapies are just not working anymore. Being able to be followed by leading clinicians, leading scientists in their field is what's going to make you have a longer survival. So I want people to know, don't be scared to join a clinical trial because that is what is probably going to be best for you at that particular point in time.
Well, thank you.
And also, I'm sorry.
No, go ahead.
I just wanted to say, to get your biomarker. If you're diagnosed, get your biomarker, ask for your biomarker so that you can also have a better chance of choosing a targeted therapy that may work better for you than traditional therapies.
Well, helpful information. Thank you, ladies, both. You are an inspiration to all. Thank you so much for sharing your story. For more information, you can visit lcfamerica.org. You can also text the number you see on your screen, LCFA, to 41444, Sandra.
All right, let's take a look at